hospitals are closing down in rural communities. That means that by extension, by Grayson's reasoning, the Democrats want people in small towns all over America to die. Let's talk about this. Dr. James Pinckney II, board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center out in L.A. After graduating from Baylor College of Medicine right here in Houston, he is the founder and CEO of Diamond Physicians, a concierge medical practice focused on the patient-physician relationship. Mr. Pinckney, welcome back to the Voice of Texas, sir.
Hey, good morning.
Well, what's your take on this? Don't weigh in on Grayson. We know he's a lunatic. But what is your take on that? Now we're starting, if you'll remember what the Reverend Wright said, America's chickens are coming home to roost. So that means Obamacare's chickens are coming home to roost, and the American people are paying the price for it.
Well, you know, Chris, this is a critical situation. Since 2010, we've had over 200 rural hospitals close, 10 in Texas alone. So when your business is 50% Medicare and the government cuts Medicare reimbursements by 2%, when you lose 2 points, that's a huge hit on your bottom line, and these hospitals cannot sustain being open.
Well, that's true. Kansas-based National Rural Health Association, representing about 2,000 small hospitals across the country, according to the Post, and other rural care providers say that 48 hospitals shut down. And as you said, we here in Texas taking a hit as well with 10 closures. But I think we're foolish to think that that's all that's going to happen. I think there are more in the pike, yes?
Oh, absolutely. There's hospitals across the country that are struggling. There's family practice offices across the country that are struggling. And we have to figure out a solution. And I believe I've done that with our model here in Dallas, Diamond Physicians. So we go away from insurance. We completely cut out insurance because the markup is atrocious. Insurance premiums are rising, networks are shrinking, so we have to cut out the middleman and go back to the 50s and 60s and deliver care directly to patients. Free market care at Diamond, so we pay a low monthly membership fee, and our clients receive unlimited visits, no copay, 24-hour access to care, all your acute medications and all your acute procedures are included. So this model is perfect for rural areas, and I'm actually going to reach out to the hospital that closed in Mount Vernon. There's a family doctor that took over that hospital that leased the space, and that's going to be a very expensive lease because it's more space than he needs. But our model will be perfect. They have a small population, 2,600 people. The membership model works perfectly in rural areas.
Yeah, this is from this piece, folks. For high percentages of elderly and uninsured patients who live in rural areas, closures mean longer trips for treatment, uncertainty during times of crisis. Quote, I came to the emergency room when I had panic attacks, said George Taylor, age 60, a retired federal government employee. It was very soothing, and the staff was great. I can't imagine Mount Vernon without a hospital. This scenario, this is Mount Vernon, Texas, I believe. But this scenario is playing itself out all over the country. And I guess you took me right where I wanted to go, Dr. James. What's the likelihood that the private sector will step into these closing facilities and turn them into areas of commerce and where health care will be delivered, but without the traitorous insurance companies involved?
Well, it's the only solution that I see, Chris. So I would love to go to Mount Vernon and set up a Diamond Physicians facility. The population there would absolutely love the care because it cuts out the middleman. So what you do, you go in. If you need a CT scan, you pay $250 instead of $3,000. With the Affordable Care Act, deductibles are high now. The average deductible is anywhere between $2,500 and $5,000. So even if you have insurance, you're going to be out of pocket up to $5,000. That's a lot of money at once for the vast majority of Americans. So why not split that up into a monthly membership fee, let's say $50 to $100 a month, and include all your acute medications and all your acute procedures. So if you have a panic attack, your out-of-pocket cost would be zero because you already paid your monthly fee, and all those services that can be handled in the outpatient setting would be included.
Dr. James Pinckney, my guest right now, Dr. James Pinckney II, he's with Diamond Physicians. Of course, the traitorous insurance companies are working against you, and they have made it impossible for concierge medicine practices like yours to be covered under Obamacare. So while people could probably weather having a service like yours while Obamacare is continuing to crank up, but sooner or later, that penalty for not buying a government-approved, government-sanctioned policy, that penalty is going to get cost prohibitive, and then you can't buy these catastrophic loss policies inexpensively anymore, again, because of Obamacare. How have you been able to put your head together with other physicians that do what you do to come up with an alternative so folks can get the government off their back and they can get the government out of their hair and get these traitorous insurance companies out of their hair and just have a direct relationship with doctors?
Yes, we have to lobby and we have to change that piece of the legislation. That's the only way our system is going to heal. I've experienced ourselves with our practice in Dallas. We've had 3 clients that were unable to afford Diamond Care in the last month because of that penalty. So they had to choose, and it was very difficult. I had a client that was crying in my office because she loves Diamond Physicians. We were able to get her an MRI for $400 instead of $4,000. She has a torn meniscus. I was able to find a surgeon to perform her surgery for $3,700 instead of $37,000.
Wow. And
she's going to be fined $2,000 if she doesn't oblige to signing up for the Affordable Care Act, which is a terrible insurance policy. So she came to my office crying, said, I just can't afford both. She pays me $195 a month. And I said, I understand. So I just put her membership on hold. I said, whenever you can come back, we're here for you. If you need anything, I will facilitate everything that I can. But we have to change that law. Direct medicine, affordable concierge should count under the Affordable Care Act. There's no doubt.
Yeah, and again, the people working against you, the aforementioned traitorous insurance companies. Every single time you come on, Dr. Pinckney, I get a spate of emails asking, when are you coming to Houston? Any movement on that?
We've got, we're in talks with individuals in Memorial City, Katy, and the Woodlands right now, trying to put together some financing and find some high-quality physicians that meet Diamond's criteria. But soon, I'm hoping to have a deal signed in the next 6 months.
All right, keep us posted, Dr. James
you guys
Pinckney.
can help. Yeah, listeners can help.
How can we help? How can we help that?
DiamondPhysicians.com. Go to our Diamond Demand Map at the bottom of the page and fill out a small form with where you live, so I can add you to that Diamond Demand Map, and that helps investors figure out, okay, where should the next one be.
Gotcha. Diamond Physicians, the name of it, Dr. James Pinckney. He runs the joint, and it is a fantastic way to eliminate government out of your life, to eliminate the traitorous insurance companies out of your life. And appreciate your time and expertise in evaluating that story and bringing that story to our attention, Dr. James. We'll talk to you again.